Recently, a patient of ours came in and she was in a motor vehicle accident. Now, we see a lot of patients in accidents. She was rear-ended and the impact wasn't significant, but it was enough for her to suffer a headache and some muscle tightness around her neck and back area. So during the time, ambulance showed up and the EMS people evaluated her and they asked her if she wanted to go to the hospital. She went. Now, here's where things get a little crazy. She went to the hospital with complaints of a headache. She was rear-ended. The car was not a total loss. She was not ejected from the vehicle. She was not bleeding. Her head did not hit the windshield. She was restrained, but suffered what's called a whiplash injury. She got the bill, and this was unbelievable. She received a CT scan of the neck, a CT scan of the head, and of course, a high-level examination from the emergency room doctor. She claims she was there under an hour. So within under an hour, this hospital, used the entire PIP allotment of funds, which is $10,000. So within an hour, this hospital collected over $10,000 on tests that were probably not necessary. Now realize, every case is different. Every patient has a different medical history. Every accident's different. So I would never tell a patient, do not go to the hospital. But hospitals, especially in this area of South Florida, are notorious for ordering these really expensive, mostly unnecessary CT scans. The CT scan would be necessary if the X-ray gave information that warranted further diagnostic studies. So I have a feeling these hospitals, especially in South Florida, know that the CT scans are very lucrative and they make a lot of money for the hospital. So what would I recommend? Well, instead of getting a bill like this, $12,000 bill, they reimbursed about $900, then the other doctor evaluated her, and they got the whole $10,000. Instead of going right to the hospital, go to an urgent care center. They could do everything except the CT scan. And if you need a scan, sometimes an MRI is even better, right? When should you consider a CT scan? Well, if you have any blood coming out of your head, that's a good idea. If you're on blood thinners, if you have a history of brain trauma, or if you have another condition, a severe nausea or vomiting, or you're losing vision, or you're losing brain function, of course, that's a no-brainer. But the majority of these injuries, these are mild concussions, which cannot be demonstrated from a CT scan. Once you go to the urgent care center, go see a chiropractor. Why? Because this is what we're trained to handle. Neck issues, headache issues, most of this coming from the neck and muscles and nerves in that region. So the moral of the story, if you are in a motor vehicle accident, a rear-end collision, and you don't want to get a massive bill and all your benefits, your PIP benefits, which are like health insurance for your auto injuries, bypass the hospital. Go to an urgent care center, go to your chiropractor, get an X-ray, get some MRIs, really get some therapies that's going to help you. This was nothing more than an expensive nap, and my patient was very upset about it. Didn't really understand it, but now she does, of course. If you're injured, remember you have 14 days to be evaluated and be assessed in order to become eligible for your benefits. Come on in, I'll go over all this with you. It's a lot of information, but if you're a injured patient in an accident in the state of Florida, you got to know really what this is about and how to navigate effectively. As always, it's never easy. It's always necessary. Come on in. We'd love to help you. Thank you.